Hi, everyone. I would like to welcome you to the ARC Alliance Building Bridges in the Community program. This program focuses on issues that affect persons with disabilities, such as autism and other intellectual developmental disabilities. My name is Casey Sewell, and I will be your host today. The ARC Alliance was founded in 1951 by parents of children with developmental disabilities. Since that time, the ARC Alliance has been a family-driven organization. The ARC Alliance firmly believes that persons with developmental disabilities should be able to experience a life equal to those of individuals with non-disabilities. The ARC Alliance believes in full inclusion and would like to see all persons with disabilities live happily and work in the communities in which they choose. Today, I will be interviewing our CEO, Paul Stengle. Paul, would you like to introduce yourself?
Paul Stengle, the CEO of the ARC. I'm glad to be with you today, and I hope I can provide some information that will be helpful to families and persons with disabilities.
Thank you, Paul. Would you like to start by telling us a little bit about yourself and your experience working in the community programs for people with developmental disabilities?
Sure. In my teens, I was in a social rec program at my church, where we went and we interacted with individuals with disability in institutions. And when I seen the level of care and how people with disability were being treated, I became an advocate for community options as opposed to institutional options. I did residential care from 1970 to 1980, and in 1980 I was hired as director of a residential program in central Pennsylvania. 6 years later, I was hired as the executive director of the ARC of Montgomery County at the time. And the ARC of Montgomery County and myself have spent over 50 years trying to give individuals community options as opposed to institutional placement.
Great, thank you for sharing. So what can you tell us about the quality of community-based services for people with developmental disabilities that are offered in Pennsylvania?
I'm sorry to report that community services are deteriorating with most providers. It is a problem that has been created because of COVID and years of underfunding. Recruitment of staff is extremely difficult. I heard of a provider having a 45% vacancy rate in direct service staff. You really can't provide services when you have that large of a vacancy rate. I know a large provider who has closed 100 beds because they don't have the staff to support the group homes that they're operating. A lot of the day programs are closed. If you're operating day programs, you're losing money, so the deficits continue to grow. If you're running group home facilities, you're paying tons of overtime, so you're facing the same funding difficulties. Again, I'm very clear, overall, the quality of services and community programs have dropped. But I want to be clear, the providers are doing the best job that they can do under very difficult situations.
And so it seems that you've indicated that funding issues in COVID-19 have deteriorated the quality of community services for people with developmental disabilities. Can you explain this further?
The COVID situation, the getting of vaccinations has been a challenge. We have seen almost all of the individuals in community programs being vaccinated. The number of staff who have been vaccinated probably is around 60%, meaning that 40% have not been vaccinated. When clients are sick, it takes more supervision. When clients are in the hospital, it takes staff to support them in the hospital while you still need to support the clients who are still at the group home. There's also a problem with the COVID is the amount of anxiety and depression. I think all the providers have seen a significant increase in individuals seeking mental health or, frankly, inpatient care. The numbers are going up tremendously. The funding issue is partly our fault. When we worked to close Pennhurst in the 70s and finally closure in the 80s, we would argue for community program based on the fact that community programs were a lot cheaper than institutional programs. The problem was that the institutional programs were more expensive because of salaries, but not salaries, benefits and salaries of direct care staff. And I think we should have been arguing for equity, and that meaning that individuals, staff who work in the community should have had the similar benefits and salaries of people working for the state in the institution. But because we indicated it was less, the state paid less. It has not been good economic times, and I know that the Secretary of the Office of Development and Program over the years has argued strongly for increases to address the staffing issues. However, the state has not been in a good financial situation, and it can be very easy to say residential programs and community workshops can go another year without an increase. But when we went to per diem rate funded, it seems that the state simply says we'll go another year without an increase. We run an early intervention program, and until this year, we had a 3% increase in 12 years. We run a guardianship program, and where we were capped at $100 per month for people in a nursing home to do guardianship. In 1988, the rate has not been increased. So it's impossible to maintain the level of care you want when it's costing you $300 to provide a service that you're able to get a reimbursement of $100. Our service coordination is very similar. In 13 years, 1 year, we got a 3% increase. Our costs have gone up about 20% in that same time period.
So it seems like funding is really a critical issue right now. In your opinion, what are some of the reasons there's not been adequate funding for community-based services?
I'm sorry, but I addressed some of that. One of the reasons I don't think the legislatures are hearing enough and the governor is hearing enough of the need to address these issues. It's not critical for families who are not in services, and for families in services, and many times they're getting the services they want, and it's not a priority to get the increases that we need. So politically, there has not been a surge of support from the individuals who need to get the support, and that's the individuals with disabilities and their families. And again, just the financial reality that the state in Pennsylvania is an aging population, and our workforce has not increased tremendously over the last 20 years. Income has risen slower than the cost of providing the supports that the state provides. So it is a complicated problem, and I think the state needs to address it and provide adequate funding so we can increase the salaries of direct care staff and their supports.
So I know right now many organizations are struggling to recruit qualified staff. We've been told that some providers are starting direct care staff in group homes at $12.50 an hour, while others are starting at $17 an hour. Why do you think there's such a wide range of starting salaries for direct care staff?
My experience is that providers who started providing residential care in the late 1990s or early 2020s have higher rates because they're got their rates initially fairly recently. So again, I think there's a real correlation between what individuals get paid based upon how long the provider has been operational. And I think that's probably the major reason. I also think the costs sometimes of running more segregated programs and programs that are less inclusive tend to be more expensive than more least restrictive programs in the community. And many of the staff who are paying the higher rates are higher salaries are providing programs in a more inclusive, less restrictive environment.
And can you explain what you mean when you say segregated programs versus inclusive programs?
Segregated programs are programs where there's a large majority of people with disability being served in one location. The more inclusive residential program would be someone who lived in a shared living situation where one person with disability is living with a family. And what we know is the growth and experience, and generally what people with disability want is the more inclusive programs. And in general, more inclusive programs cost less. And again, some of the residential providers who are doing those more integrated programs are able to pay their staff significantly higher than the segregated programs that tend to be more expensive.
Perfect. Thank you for that information. So in nonprofit community-based services, there's a wide range of salaries for CEOs. Some CEOs are making well over $300,000 while paying direct care staff as little as $26,000 per year. What are your thoughts and feelings around this?
Generally, CEOs in the nonprofit business get paid far less than what they would do in a profit-making arena. And I support that. If you want to dedicate your life to assisting people with disability in a nonprofit, I think you expect not to get paid what you would do in a profit-making venue. The few execs, and I only know 2 execs in Pennsylvania who make over $300,000 a year, run programs that serve over 500 people. If you had 500 staff and you wanted to give $1 an hour raise, it would cost you about $1,040,000 a year to give $1 raise. If you have an executive director who's making $250,000 and you give them a $300,000 raise, not $300, a $50,000 raise, so they're making $300, it's $50,000. So I don't think the salary of CEOs is the problem. I think in general, CEOs are paid lower than what their counterpart in the profit community. And when you try to raise salaries of direct care staff, it is a heavy lift. It's an extremely regulated, complicated service provision. You have all the labor laws and all the requirements of the Office of Developmental Programs. And it takes a great deal of expertise to manage these programs successfully. And frankly, I think most executive directors and CEOs should be paid more, not less. And again, I understand the concern when you hear someone's making $325,000 a year. But again, I assure you that is not the case in general. And it doesn't negatively affect, I think, the cost of the direct care salaries, because again, to really raise those salaries where they should be, and I think probably about $20 an hour actually, it would be an extremely heavy lift.
Yeah, thank you for explaining that. And then when you lay out the math behind it, it really does make a lot of sense. So what advice would you give to parents who are seeking or are receiving services or community-based programs for their child?
The first is be patient. We will get through the COVID crisis. Things will get better, but I think we have to have some patience to providers who right now are extremely understaffed. That doesn't mean you should tolerate neglect or abuse. We need to address those issues and they need to be fixed. And we need people with disability to be active. And I don't think families can sit and say, well, we're under quarantine and clients are going to be staying in their bedrooms until we get through the quarantine periods. I think the providers have an obligation to see that clients are kept active, safe, and have a quality of life. Saying that, again, if someone misses an activity because of lack of staff or because there's a slight reduction in activity, I think we need to be patient. So again, I would say monitor, and I would also, if you can be involved, if you can take your child home and do outings for the day, anything that supports your child during that process would be helpful. But just as important, and we tend not to ask, but we should be telling our legislators, we want increased funding that is targeted to direct care staff, and they need to hear it from us. Not probably, 3% of the population has IDD, probably about 1.5 to 2% of the population has autism. So roughly 5% of the people are either autistic or have IDD, and they have families, and those families are probably in the 2 or 3 people. So if you look at the number of people that are affected by the service system, if we could speak in one voice and require the funding for appropriate, adequate funding programs, we could move the world. But until families decide that they need to express that, we are not going to get where we need to go. The provider system has been advocating strongly, but we need more numbers and we need more people speaking to the issue.
Thank you, Paul. Given the crisis in the community-based systems, if a family is in need of services for their children, do you think they should consider the institutionalization of their child in state-run centers instead of advocating for community-based services?
I don't know of any good argument for institutional care. When we make decisions for people we're guardian for, we use different standards to do it. And one of the standards we use is supplemental judgment, which means what would the person choose if they weren't disabled? And I assure you, nobody would choose who's not disabled to live in an institution. I've said to legislators who make the argument for institution, the day they want to move into an institution is the day I'll support disabled people moving in an institution. The data would indicate in the more segregated programs, you're more likely to be abused and neglected than in a more inclusive. There's a lot of potential reasons for that, but I don't think we fully understand it. But I think one of the reasons are, if you're involved with more people without disability who are not getting paid to be with you, the more likely somebody is going to observe or that you are being neglected or abused. And when you're in a segregated setting, we have seen, I'm sorry to report, particularly in institutions, where staff were reluctant to report abuse and neglect. And frankly, there was a lot of peer pressure from employees to have people not report it. I think that's changed over the last 20 years, 30 years. But again, when we began to close institutions in the 70s and move people into the community, the level of abuse in institutions were really horrendous. So there is not a safety factor, but there is a risk factor. And it's very clear a lot of families don't want to take that risk, and that's understanding. But we have a right to a certain degree of risk. We want to keep people safe, but we want to have people learn and get exposure. So it can be very difficult to have a person with disability ride public transportation, particularly if they're not being supported. But if someone can ride a bus, it can open up a whole new world by having the ability to take public transportation. And I think it's worth the risk. And we need to try to minimize the risk, but again, learning and exposure is a certain degree of risk.
Do you think the only solution to this is to increase funding, or do you think that funding is only part of the problem?
I think funding is a major part of the problem, but it's a heavy lift. But I think we can do things, and things need to be done to make the ability to provide quality care. One of the significant problems is that over the last 20, 30 years, we have been regulated to death, and we give increased responsibility to providers and to service coordinators. And I think we need to seriously look at our requirements and to simplify them. When I was a director of a residential program serving over 100 people in central Pennsylvania, we had no regulations, but we were able to push the quality of community services to a very high level. Frankly, when we got regulations, the standards weren't for the high level of quality we were trying to reach. It was to meet the minimum regulations. And when you met the minimum regulations at 100%, you thought, I'm doing a great job. We have to go beyond a minimal requirement, and we have to look for a higher quality of care. And the state has to support that by looking at their regulations. And sometimes there's a knee-jerk reaction to a problem where the solution is, according to the state, well, we'll require more requirements. And in our early intervention program we run, they changed the model of the approach. We've got to retrain staff, and we have 3 counties that we provide service for. All 3 counties give different requirements. In service coordination, we have the same problem. I think we're providing service coordination in 7 counties, and each county has different requirements. It comes to a point where you spend your time trying to meet the requirements and not pushing the envelope for higher quality of care. We need to go back a little bit. We need to get minimal standards that make sense, and we don't need to continue to try to resolve problems by more requirements, particularly when you have staff shortages and are trying desperately to keep up with the responsibilities of providing care and meeting the regulations. And there's sometimes, I don't think, enough thought when regulations are passed. And again, minimal regulations, but we also need to figure out how to hold us to higher standards of the quality of care. When given the opportunity to choose a less restrictive environment or a more restricted environment, if they understood the choices, they always choose a least restrictive environment. When I talk to people with disability and I say, what do you want, for those who can express it, they want to live on their own, they want to get married, they want to drive a car, they want to party. They want what most individuals in their age brackets want. And again, I think pushing the system to have people in the least restrictive service will save us a lot of money. And until we can move them, frankly, we're not going to be able to serve everybody that needs service in traditional programs. The cost of that is out of the ballpark. I think we have probably about 2,000 people on the emergency waiting list, people who need services today. And if you want to put them in an institution, it's probably about $200,000 each. We can't afford, not to, per year. We can't afford it. We need to serve people in the least restrictive. And not only because it's more effective and less expensive, it's a higher quality. And that's what I hear from people with disability that they want.
Are you optimistic that we can provide adequate community-based services to individuals with intellectual disabilities?
Some mornings it's hard to say, but in general, when I talk to providers and I talk to the state, everybody is deeply committed. And I was very pleased 2 weeks ago. I was at a meeting of providers and I suggested that the state should give economic incentives to move people into less restrictive programs. And it was unanimously supported. And basically what I heard, give us the resources and we can get it done. But again, when you don't have funding, you don't have staff, you have increased regulations, it's difficult to look at those higher level things, how to move the system forward, how to work outside of the box. And with that level of support from providers and frankly, the Office of Developmental Programs, I think we can do it.
And if anyone was interested in getting involved to help resolve this crisis, what can they do?
Well, as I indicated, we need to get legislative support for this. And I would suggest you contact me if you want to be put on alert. You can go on the ARC of PA or the ARC of US and look at the issues we're trying to push forward and write your legislator and say, hey, this is important to me. Frankly, people who have family members or are disabled have the same issues that the general public does. And those issues are, I want lower taxes, I am either pro-gun or not pro-gun, I'm pro-life or pro-choice. Those issues is what people vote for. And until the disability community can say, wait a minute, I'm voting for disability, we're not going to get the legislative support we need. And the legislators generally have been good. They've done a lot, and they've done it not because of lobbyists or because of letters. They did it because they were convinced it was the right thing to do. But I'm sorry to report, the right thing to do doesn't have the clout that the voting public have in this arena. And if you're an advocate for people with disability, you need to be advocating for government taking what I believe is the appropriate role in supporting the programs that they have decided to fund, and they need to fund them appropriately.
Thank you. That's an excellent perspective on the situation. So I just want to say thank you, Paul. Thank you for your time today. And thank you for everyone for joining us. If you or anyone you know would like to get involved in supporting the ARC achieve its mission, or would like to inquire about our services or have any additional questions, please feel free to contact Paul, our CEO, at 484-868-0443. Thank you and have a wonderful day.
Thank you.